Hello, my name is Brittany Hicks, and today I'm here to show you how to properly give the patient a bed bath. First, I'm going to uplift the covers and check my patient's wristband for identification. Could you please state your name and date of birth?
Precious Parks, 12/24/93.
Okay, thank you. What are your bathing preferences?
I like the water pretty hot.
Okay, I'm checking the water to see if it's to the patient's liking. It's pretty warm. Okay, next I'm going to ask my patient a few questions. Are you allergic to anything such as latex?
No, ma'am.
Okay, I'm going to check my patient's arm to make sure there's not any cuts, scrapes, or lesions. I do see that there is a cut right here. We're going to make sure that when I wash my patient's arm that I do not irritate the cut that's there. Now I'm going to perform hand hygiene. I'm going to put my gloves on next. As I'm putting my gloves on, I'm going to ask my patient if you would prefer soap during your face wash.
No, ma'am.
Okay. Now I'm going to properly show you guys how I'm going to put my towel in a mitten shape. Now I'm going to damp the towel. I'm going to start at the forehead and work my way around to the cheeks. As I work my way down the other cheek, I'm going to do the chin. Now I'm going to proceed to the eyes, and I'm going to start from the inside of the eye to the outer parts of the eye. I'm going to use this side to clean this eye, and I'm going to use the other side of the towel for the other eye. So make sure I don't cross-contaminate or get anything from the other eye into this one. Now I'm going to go to the neck and make sure I properly wash the patient's neck. Then from the neck, I'm going to go to the ears. Now I'm going to do the other ear on the other side. This completes the washing of the face. Now I'm going to put my towel back into the water and also check the temperature as well. While I do that, I'm going to get this other towel and place it under my patient's arm so I can perform and show you how to properly wash the arm. I'm going to create a mitten as I did before. And wipe my patient's arm, keeping in mind that I'm not going to put too much pressure on my patient's cut. Also, while I wash the arm, I'm going to work my way down to the hand and wash the inside of the hand and the outside of the hand. Also, while I do that, I'm going to make sure I go in between each finger. And after I do that, I'm going to go under each fingernail to make sure they're clean as well. Now I'm going to lay the arm down and make sure I dry it off, and the hand as well. Put this back into the water and check the temperature to make sure it's still to the patient's liking. I'm going to remove the towel and put the towel under the underarm so I can wash this as well. I'm going to quickly put my hand back in it and wash up under the armpit. Okay, now I'm going to move on to my patient's leg. I'm going to place this towel underneath it. I'm going to rinse out my towel again and check the temperature to make sure it's to my patient's liking. I'm going to put my towel, create a mitten again. Now I'm going to wipe my patient's leg. Now I'm going to work my way down her upper thigh. Then I'm going to come over here and work my way towards her foot to make sure it is clean as well. This concludes my video. Thank you guys for watching.